Chapter 15, Segment 3 starts talking about Kluver-Bucy syndrome and how bilateral amygdala damage characterizes emotional changes. So it talks about how monkeys with cut amygdalas showed more social affiliation and less anxiety and be more likely to mess with alpha males or people that they usually would fear. This means that fear is mediated by a circuitry that includes the amygdala and reliably elicit fear by using a type of classical conditioning called fear conditioning, which is where previously neutral stimulus is repeatedly paired with shock or some other unpleasant experience, causing the subject to act fearful in response to the stimulus. The low road from the thalamus to the amygdala bypasses conscious processing and allows for immediate reaction. The high road pathway routes the incoming info through the sensory cortex, allowing for processing that is conscious and integrated with higher level cognitive processes. The low road is obviously faster. The interconnections of this are the lateral amygdala, where info is encoded for specific stimuli, to the central nucleus, to the brainstem, to the periaqueductal gray, striatum terminalis, and lateral hypothalamus. SM was damaged by both of the amygdalas, demonstrated the value of being afraid, because if you're not afraid, certain things happen. Disease destroyed the amygdalas in late childhood in SM too. The two cerebral hemispheres process emotion differently. Emotional syndromes, hemispheres are different in emotional tone, likely to have language deficits, and right parietal or temporal cortex are excessively cheerful and indifferent with loss. Processing of emotional stimuli, visual presentation of different stimuli to the left versus right hemisphere similarly reveals hemispheric differences in visual perception of emotional expressions. And the asymmetry of emotional facial expressions shows that facial expressions are not symmetrical and that left shows more emotion than the right. Different emotions activate different regions of the human brain, obviously. So the insula and anterior cingulate cortex are more stimulated for love versus friendship. The cauda and putamen are as well, and envy involves activity of the cingulate gyrus and nucleus accumbens. No simple one-to-one relation of emotion and brain region, obviously. Neural circuitry, hormones, and synaptic transmissions mediate violence and aggression. So there's intermale aggressions in most vertebrates. It causes them to fight each other to gain access to mates, usually. Androgens seem to increase aggression and adaptive in gaining access to food and mates. Obviously, as maturity and androgen levels increase, so does fighting behavior. So as people go through puberty, males go through puberty, they're more likely to demonstrate fighting behavior, violent behavior. More clear-cut in animals than humans, though. Military veterans show antisocial behavior correlated to testosterone levels. These studies are complicated because experience and levels of dominance can affect the data. Aggression has several neurochemical correlates. Low levels of serotonin activity in low aggressive monkeys. Biopsychology of human violence, so the emotional discontrol syndrome. Temporal disorders that may underlie some forms of human violence, and psychopaths are individuals who are incapable of experiencing remorse. Chapter 16 starts with the hypothalamic pituitary adrenal axis involved in depression. It talks about Cushing syndrome, where it's a condition in which levels of adrenochlorocorticoids are abnormally high. Many causes possibly including a hormone-secreting tumor or therapeutic treatments with synthetic glucocorticoids. 85% of people with this experience depression early before other signs. Suicide victims show very high levels of circulating cortisol, while hospitalized patients with depression show elevated cortisol levels. Suggests that adrenocorticotropic hormone is released in excessive amounts by the anterior pituitary. Dexamethasone suppression tests reveal the tendency to release excess cortisol is also a standard method of assessing hypothalamic pituitary adrenal function. Even late in the night, it fools people's hypothalamus into believing that there's high levels of cortisol circulating in most people. It does not suppress cortisol release. Women are more likely to be depressed than men by almost twice. They experience postpartum depression, which is bouts of depression either immediately preceding or following giving birth. Shows some combo of hormones affects this. 1 in 7 women will experience with no increase in amygdala activity, unlike normal depressed people. Depression and sleep. Depressed individuals have sleeping and inability to maintain sleep. They have a reduction in stage 3 and also seen an increase in stage 1 and 2. They enter REM earlier, and REM is also vigorous and it increases in the first half. There's such things called seasonal affective disorder, where people get sad because of the short days of winter, and scientists are still searching for animal models of depression. Because they can see social contact evident in animals, so there's learned helplessness in animals exposed to repetitive stressful stimulus such as electrical shock that it cannot experience. Like depression, it has been linked to decreased serotonin function and dopamine. Removing olfactory bulb from rodents also creates a model for depression like increased irritability. Selective breeding of certain breeds results in organisms with reduced body weight and increased REM. They're called the Flinders-sensitive line. People with bipolar disorder show repeating mood cycles. So bipolar disorder is periods of depression alternating with periods of excessively expensive mood that includes sustained overactivity, talkativeness, strange grandiosity, and increased energy. The rate of alteration occurs differently, so there's rapid cycling where there's 4 or more distinct layers in one year, and may even show several a day. Glycothymia, less extreme moods, cycling between dysthymia, which is poor mood or mild depression, and hypomania, which is increased energy and positive mood that lacks some of the bizarre aspects of frank mania. Complex heritability, it's linked to many traits. Many exhibit large ventricles, leads to damage of the limbic system, such as the amygdala and hippocampus. Atypical antipsychotics have helped reduce manic episodes. Bipolar disorder is similar to schizophrenia. Lithium is beneficial in treatment of bipolar disorder, but well managed could result in overdose, and it helps to stop manic disorders. Several types of anxiety disorders exist. Classic psychology disorders that include recurrent panic states, generalized persistent anxiety disorders, and PTSD. Can include generalized anxiety disorder and panic disorders. Generalized persistent and excessive experience for months. Panic is recurrent transient attacks with intense fearfulness. Temporal lobe abnormalities and overall temporal lobe volumes tend to be lower in patients with panic disorders. Changes in the amygdala associated with circuitry may underlie the symptoms. There's phobic disorders, which are intense irrational fears, like fear of heights or fear of ducks or something. Activity or situation that a person feels strongly to avoid. Drug treatment of anxiety provides clues for mechanisms of disorder. So benzodiazepines like Valium and Xanax are combat anxiolytics, anxiety dissolving. They bind to GABA receptors, acting as non-competitive agonists, results in the enhancement of GABA's mediated postsynaptic inhibitory synapses in the brain, especially found in the cerebral cortex, such as the hippocampus and amygdala. Everybody relates the permeability of neuronal membranes to chlorine ions, and the presence of GABA benzoates enhance GABA to increase in chlorine permeability. New drugs such as Buspar, which are serotonin agonists, have shown improvement in helping anxiety. PTSD is when bad memories won't go away. Memories of unpleasant episodes that plague the victim, having memory changes such as amnesia, flashbacks, and deficit in short-term memory, suggest involvement of hippocampus. Right hippocampus is smaller in combat veterans with PTSD. Inherited tendency to have small hippocampus is true, though, and perhaps lower rates of adult neurogenesis. Patients learn to avoid stimuli associated with the original trauma, fear conditioning. Sites projecting to the amygdala, such as the hippocampus and prefrontal cortex, may also lose their effectiveness in suppressing learned fear responses, and there's a long-term reduction in cortisol. In obsessive-compulsive disorder, though, thoughts and acts keep repeating. OCD live lives riddled with repetitive rituals, persistent thoughts that they cannot control or stop. Compulsions, locking the door numerous times despite knowing it's excessive. Obsessions, recurrent thoughts such as fear or germs. Compulsions are just something you feel compelled to do, even though you know it's crazy. Eventually isolates people, and people often hide symptoms onset as 25 to 44 years old. Prozac and Luvox treat OCD, and depression and OCD often go hand in hand, which is hence why Prozac is used to treat it. OCD and Tourette syndrome are part of a spectrum of related disorders. They're comorbid usually, and they occur together. Heritable genetic component of OCD can be triggered by genes linked to BDNF and serotonin receptors. Also can be triggered by disease. Antibodies attack own brain while treating some other type of disease.